Now, Secretary of State for Health and Social Care, Wes Streeton, gave a speech at the Labour Party conference this morning and health policy experts and NHS staff from National Campaigning Organisation Keep Our NHS Public join us now to share their response. And we have speaking now is Dr. John Puntis, Co-Chair of Keep Our NHS Public and retired consultant pediatrician. Now, good afternoon, John. Now, you have obviously listened to the speech and you have an interest there. So what are the key points?
I mean, the key points he keeps making is that the NHS is broken. I think that's a wrong assessment. I think it's not in great shape, and the Darzi report has shown that, although all that information, of course, was already known. And he also says that Labour does want to transform the NHS, but through a process of reform rather than extra investment. And it's very difficult to see how you can have one without the other. And even Lord Darzi highlighted that there's a shortfall of about 37 billion in capital investment in the NHS compared with other similar economies and services. So I think to imagine that you can make things better without investment is a non-starter. And then the other issue, which I think was very disappointing, is the emphasis on turning to the private sector to help sort out the NHS's problems. So there's this kind of paradox that on the one hand, Wes Streeting wants to get rid of a two-tier system, but on the other hand, he's suggesting actually the NHS should be sending patients, and that means sending money to the private sector rather than investing in improving NHS services. And I think that is a paradox.
Yeah, I mean, yes, I think the speech probably did not shed light on a number of things which you've alluded to. You know, for example, the system being described as broken, I think Keir Starmer made it clear that there's no extra money going into the National Health Service. That was my understanding. You could correct me if I misunderstood that. And also they're wanting to make reform. They wanted to reform the system. Did you hear anything of a reform that, you know, you can think that this is a positive thing that I can embrace?
Well, not so far. It was short on details. I mean, they talk about three shifts in terms of change. So one being a shift from hospital to community, another the reliance on new technology, and the third being prevention. Of course, these are not novel, and you'll find them in many articles about the health service going back many years. And in fact, in Simon Stevens' 5-year plan, 10 or 15 years ago now, that the same was said. We have to make the NHS into a health service, not just a sickness service. We have to introduce new technology and make it more efficient, and this may save money at the same time. And we have to move services from hospitals. But actually, Simon Stevens in that document recognised that would require investment. So it wasn't a cost-free exercise. We don't seem to have that recognition in the current Labour front bench. And actually, if they looked at what we know works, they'd go back to what New Labour did when they did boost NHS funding to much nearer the levels of comparable European countries. And that resulted in investment in staff, increase in productivity, much improved patient satisfaction, and much better performance in terms of targets being met. And I think that's an important lesson they seem to have forgotten about.
Now, your organization is a campaign organization. How do you see your campaign going to get your message across? or about what the changes that you want to see, or the way in which you see the health service developing?
Well, a good question. I mean, we are trying to build a grassroots organisation, drawing in members of the public, drawing in people who work in the health service, drawing in trade unions who work in the health service. We have 50 groups or so around the country, including one in Leeds, and we try and talk to the public as often we can in street stalls, for example. We go along to health meetings. I was at the Integrated Care Board meeting for West Yorkshire yesterday to put a question at the beginning of the meeting, and we have a trade union-facing section in the organisation, Health Campaigns Together, and we produced lots of literature. We were giving out bulletins at the Labour Party conference over the weekend, and we also have a very good website which is full of useful information in terms of the state of the NHS and our vision of how we would like to see the NHS restored to a service based on its founding principles.
Now, you described the speech as lackluster. If there was one thing that you could have done or said, or that you thought could have been said to change that, what would it be?
It would be, for me, it would have been saying the NHS is under extreme pressure, but it isn't broken, and with proper investment, we can return it to the model that Bevan put forward in 1948, when the economy was in dreadful shape, but we actually built a national health service which became one of the best services in the world, and that's our aspiration, is to go back and make this a public service, publicly provided, but once again is one of the best in the world.
Yeah. I mean, this is the one area that I think the public is probably all on the same page. We all want to see a strong national health service.
Well, I hope so. I think the politicians are out of step with the public sentiment at the moment. The public do want a health service based on its founding principles of funded out of taxation and publicly provided. And they're actually against privatisation rather than wanting to see more of that.